Niall Ferguson, thanks for being with us here on the Howie Carr Show.
Great to be with you, Howie.
Let's talk about let's talk about what you said, the lower tolerance for risk that modern Americans have compared to our predecessors 60 plus years ago. Tell us about how people in the U.S. handled the Asian flu back in the 50s.
Well, I think it's great that you pointed out that this experience was much closer to our own than the really terrible pandemic of 1918-19, which was a far, far worse disaster worldwide. Something like 39 million people died in 1918-19. If you translate that into 2020 population, you're looking at 160 million. We're nowhere close to that. We're much closer to 57, 58. When somewhere around 0.04% of the world's population died. It's about the same, in fact. The U.S. had a better experience in 1957-58 than it did in the last year and a bit. But I think that's partly because we did indeed have a different attitude towards risk in the 1950s. This was, of course, a time when people had fresh memories of World War II, not to mention the Depression, as well as the Korean War. And, of course, there were many diseases that had still to be defeated. Polio was one of them. And reading the accounts of that time and also talking to people who remember it, because there are plenty of them still alive, it's clear that our attitude was very different, and nobody thought for one moment of locking down the economy in 1957. They didn't even close schools. They accepted that there was risk, and indeed there was risk to young people, much, much more risk than from COVID, and life went on. So clearly a lot has changed since 1957.
Well, as you mentioned, one of the rock and roll hits of the year was the Rockin' Pneumonia and the Boogie Woogie Flu by Huey Piano Smith and the Clowns. A lot of us know better the Johnny Rivers remake, but I mean that was basically making light of the entire problem, wasn't it?
Yeah, and it tells you a bit about the very different attitudes at that time. I mean, as I said, the Asian flu, as it was possible to call it in those days before political correctness, was actually a disease that hit teenagers pretty hard, as well as the very young. It was very different in that respect from COVID. But people were kind of joking about it, and when I talked to people who were around then, they recollect the kind of stoicism and acceptance that life was full of dangers, and you just had to take it on the chin and keep on keeping on. Of course, we didn't really have the option in 1957 to work from home in large numbers because there was no internet. In fact, a significant number of Americans didn't even have the telephone. So we didn't have the option to do lockdowns back then. But looking at the kind of advice that Eisenhower, who was then president, got from his public health experts, nobody considered anything other than just making sure that the hospitals were able to cope with the people who got really sick. Everyone else was told, take a day off work, take a day off school if you need to, and drink plenty of water and fruit juice. That was the kind of philosophy at that time.
I've been citing all week the numbers you came up with about how much Eisenhower asked Congress. I mean, the number now is up for Biden is up to $7 trillion. $7 trillion. And yet, I'm going to read now from your Wall Street Journal piece. The President Eisenhower asked Congress for a mere $2.5 million, $23 million in today's inflation-adjusted terms to provide additional support to the public health service. $23 million versus $7 trillion. How incredible is that?
It's extraordinary. It's to be transported back to a different time. Eisenhower's view was that, there should be a little bit of help for, particularly for the hunt for a vaccine, but that was about it. And if you look at the economic data from that time, it's not visible that there was a pandemic. There actually was a slight recession at that point. It had nothing whatever to do with the pandemic. It was a monetary story, and so you wouldn't know that there had been such a serious public health challenge. The Eisenhower administration was, of course, far more concerned about the Cold War than it was about flu. This was the same year as Sputnik, and the president thought that probably just did outrank a new strain of influenza. But I don't want to make light of it. It was a a pretty serious episode, and a friend emailed me the other day who was 10 at the time. He said, I was sick that year. It was the sickest I've ever been in my life. So this was not as bad a tragedy as COVID, but then it was a younger and maybe also a healthier population. Let's not forget, there wasn't much in the way of obesity in the United States in 1957.
Because everybody smoked cigarettes. That's why.
They did, which probably didn't help in other ways with the rest.
As smoking declines, obesity has increased. I think they're pretty much related. I listen to this again. This is from your story, your excerpt in the Wall Street Journal. This is the Association of State and Territorial Health Officials. Now, these are the same people that today. These are the people who come out with white coats accompanying the local governor or the local mayor and, announce that, they've been studying the charts and following the science and the data and that everything has to remain locked down indefinitely, et cetera, et cetera. But this is what the Association of State and Territorial Health Officials, the same people as the Dr. Sutters and the rest of them and the guy in woman, in Pennsylvania, Dr. Levine. This is what they were saying in 1957. There is no practical advantage in the closing of schools or the curtailment of public gatherings as it relates to the spread of this disease. I think we would have been better served in the United States, in the UK probably, and elsewhere if we had followed the advice of the health officials in 1957 rather than the officials of 2021.
Yeah, I mean, I think we kind of oversimplified this last year and made it a choice between total lockdown or letting the virus rip. And I think that was the wrong way to think about it. Actually, there were ways of dealing with COVID that were far less disruptive than lockdowns. They did them in Taiwan and South Korea. That is to say, they ramped up testing, they contact tracing, and they isolated the people who were sick and infectious. We did it around January, February, and then panicked in mid-March. And, looking back, the lockdowns of the spring were incredibly economically disruptive. I think the biggest mistake, the one that we're going to really come to regret, is closing the public schools for as long as they've been closed in many states, including California, where I'm based. I think that has just taken kids in public schools and deprived them of a year of education, and it will not be easy to repair the damage that has been done there. And considering how little risk there was to kids, and considering that private schools seemed able to reopen, you have to wonder just what the priorities of the teachers' unions and the local officials were. I have to say, I think this was one of the notable errors. And they didn't make that mistake in 1957-58, even although actually kids were much more at risk from the Asian flu than they were from COVID.
Right. Well, my aunt was a teacher back then, and I lived with her, and I don't even remember in Portland, Maine. I don't even remember her being a member of a union. But now you have as we're seeing now from the stories that are breaking, the teachers' unions have basically been dictating policy to the Centers for Disease Control, and I mean, again, that was unthinkable in 1957-58. I mean. Federal, I don't know about local, but federal employees couldn't even unionize until 1963. JFK was the one who allowed that, one of the worst mistakes of his presidency, And,
I think one of the things about reading Doom is that you kind of are transported back, and it's not that long a time, to a very different America, where the federal government was significantly smaller. The bureaucracy had not bloated out the way it did after the 1970s, and you didn't have these public sector unions wielding disproportionate political power. That for me was one of the real revelations of writing the book. I guess I hadn't realized just how much this country had changed in the short space of time. Remember, you can tell from my accent, I'm an immigrant originally from the UK, but I think it's the kind of realization that America has morphed in a whole range of ways, some of which I think people don't quite notice because it's been imperceptible. But take yourself in a time machine with my book and you'll be transported back to a 1957 America where this kind of crisis just was unthinkable and was handled completely differently.
I know. I think the one sentence in this piece in the Wall Street Journal that stuck out to me more than any other was, your words, perhaps a society with a stronger fabric of family life, community life, and church life was better equipped to withstand the anguish of untimely deaths than a society that has, in so many ways, come apart. And I mean, I think that sums it up. I mean, in all of the issues that we've been discussing, it's a part of the America has fallen apart in so many ways. And this is an example.
Well, some of your listeners may have got the allusion there to Charles Murray's extraordinary book, Coming Apart, one of the best works, I think, of social science about this problem ever to be published. The United States is not just polarized in terms of income and wealth. I think what's really shocking is the way everything's become a partisan issue. Nobody in 1957 would have thought of, for example, vaccines as really a political issue. There was tremendous happiness at the speed with which a Montana-born scientist, whose name was Morris Hillman, found a vaccine for the Asian flu, and pride in the speed with which it was then manufactured by the U.S. Drug companies and rolled out, first to the military, to the president, and then to the rest of society. You can kind of trace back to those days our habit of giving elderly Americans a seasonal flu shot. Unfortunately, everything became politicized in America to the point that, you know, even wearing a mask ceased to be a matter of public health, and it became a political issue. And of course, you know, we saw those tremendous protests last year when you might have thought the public health authorities would have been concerned, but it turned out that there were certain kinds of large-scale public gathering that didn't pose threats to public health. And yes, ordinary folks see the extent to which public health advice is unreliable because it's got politicized. Yeah,
we mentioned earlier the Sturgis motorcycle rally in South Dakota last August. There was San Diego State was saying they had a quote-unquote study that showed there were going to be 267,000 cases that were spread of COVID from this one motorcycle rally of less than 500,000 people, and now the CDC is saying there's 400, not 267,000, and Governor Noem in South Dakota is even disputing those numbers. So I mean, you could in those days too, you could trust. I think, or at least most Americans had trust in the numbers. No one has any trust on either side in any of these numbers now.
And I think that's understandable because of the way in which public health officials have played fast and loose with the truth, and that's undermined public confidence in a way that really you didn't see back in the 1950s. And I'm going to confess to having felt a good deal of nostalgia as I was writing that part of the book for a younger and more dynamic and perhaps less risk-averse America.
I feel the same way just reading about it. Niall Ferguson, I'm looking forward to reading your book, and it was a great piece in the Wall Street Journal, and the book's title is Doom: The Politics of Catastrophe, and it was published yesterday by Penguin Press, and you can get it anywhere. Niall Ferguson, thanks for being with us. We really appreciate it. Why buy gold? Are you watching what is happening in the world today? Global pandemic, U.S. debt piling up, spiking inflation, and the looming Biden tax plan. In the 2008 financial crisis, many Americans lost a large portion of their retirement savings. So what are you doing now to protect your money? Well, many turn to Goldco, the leading gold IRA company in the U.S. and four-time Inc. 500 winning company. With an A-plus rating from the Better Business Bureau and thousands of five-star customer reviews, you can trust the team at Goldco to help you protect and grow your wealth. Go to goldco.com/Howie Carr to request your free IRA guide that uncovers the secret that financial advisors won't tell you. So what are you waiting for? Don't delay and fall victim to another stock market crash, inflation hike, or dollar decline. Visit goldco.com/Howie Carr to get your free IRA guide today. If you visit goldco.com/Howie Carr now, Goldco will give you up to $10,000 in free silver when you open a qualifying account. That's right, up to $10,000 in free silver. I'm Howie Carr.
Did you miss part of today's show?
What we've got here is failure to communicate.
Just search Howie Carr on your favorite podcast app and listen anywhere, anytime.